Pigmentation Britenol protocol. This is a course of 6 protocol done every week over 6 weeks, and this protocol is to target any type of pigmentation including sun damage, age spots, even melasma. And the first stage of the pigmentation Britenol protocol is the lymphatic drainage. Lymphatic drainage. We'll be using a light facial oil to help us glide, and generally I like to put on a bit of cotton wool and then just put my handpiece on there, get the minimum amount to help me glide on the skin. So I got that ready here, and on the main screen to do the facial lymphatic drainage we move into the facial lymphatic drainage button. The vacuum control comes at 3, stays at 3. And from the screen you can also follow which handpiece to use and the vacuum settings as well. This is the handpiece to use for the lymphatic drainage, the glass tube. You have a little hole here while you'll be doing your double pumps. If you press the white button here, this comes off, and this needs to be cleaned and alcohol wiped after each use, as it's direct on the skin and risk of cross-contamination, and clicks back in. To start the lymphatic drainage, we're going to open the thoracic channels, for the face, which are on the patient's collarbone. So we feel the patient's collarbone, and starting from the middle and under, we press once, move out slightly, press again, and the third one is almost on the shoulders and press. And this is repeat twice. So 1, 2, and 3. My pressure is slightly hard on the area, not just really lightly touching, but pressing to make sure that I got the channels open. And then I press the on button and I'm ready to go. You can turn this round and round the way you want to hold it. Everybody uses a different finger, just find your own way, which one's more comfortable. And what I will be doing is actually popping the handpiece on the cotton wool with the oil on and doing a very gentle pump to get the oil inside the glass. If I can have your head turned this way, please. Now, the first note that I'm going to start with is, or number 1, is at the back of the ear. So I place the handpiece there without my finger being on the hole, and then I'm going to count my double pump. 1, 2, and on the third one I hold and I glide to the bottom of the neck. Number 2 will be at the ear loop here. Again, put it on. 1, 2. On the third one I hold. Now move to the back of the ear, which is number 1, without losing the contact. Release first and then start my count. 1, 2, and on the third one hold and glide it down. Number 3 is the top of the ear. 1, 2, hold, move to ear loop, which is number 2, release first and then start the count. 1, 2, hold, back of the ear, number 1, release first. 1, 2, hold, and glide. That's our 1, 2, 3 around the ear done. Now we move to the middle of the face and then have as much oil as you need and you like. Our 4 and 5 are on the chin, and these 2 are going to come direct to the back of the ear, number 1. We'll start with number 4. 1, 2, hold, and we move without losing the contact all the way to the back of the ear. Release first. 1, 2, hold, and glide. 5 is still on the chin, slightly higher, again goes to point number 1, back of the ear. Hold, all the way to the back of the ear. Release. 1, 2, hold, and glide. Then we have our corner of the mouth and upper lip, 6 and 7. These goes to number 2 first, then back of the ear and then down. So start with the corner of the mouth, 1, 2, hold, all the way to ear lobe number 2, release first, 1, 2, hold, back of the ear number 1, release first, 1, 2, hold and glide it down. Same for the upper lip, 1, 2, hold, to number 2, ear lobe, release first, 1, 2, hold, back of the ear, release first, 1, 2, hold and glide. The next patch will be the corner of the nose, corner of the eye, coming to number 3, top of the ear, then 2, then 1, then down. Start with the corner of the nose, 1, 2, hold, all the way to the top of the ear number 1, release first, 1, 2, hold, to ear lobe number 2, release first, 1, 2, hold, back of the ear number 1, release first, 1, 2, hold and down. So we've done all the points on the lower face, and on this part of the face, if we had lost the contact on any of the nose, we have to repeat that again because we're not completing the drainage. Now come to do our 10, 11 and 12, which are on the forehead. As this area is a bony area, it's very likely that we will lose the contact. We don't have to repeat it. We're going to go slightly slower and maybe apply a little bit more pressure to keep our contact as much as we can. But it doesn't matter if we lose the contact, because as soon as we come to number 3, top of the ear, we'll pick it up. So our 10, 11 and 12, 3 points on the forehead, comes down to 3, 2, 1 and down. 1, 2, hold, and moving slightly slower and applying a little bit more pressure, coming to number 3, release, 1, 2, hold, move to ear lobe number 2, release, 1, 2, hold, back of the ear, release, 1, 2, hold and glide it down. And then the next one a little bit higher, 1, 2, hold, release, 1, 2, hold, to ear lobe, release, 1, 2, hold, back of the ear, release, 1, 2, hold and glide. And the final one is higher on the forehead, 1, 2, hold, to number 3 again, release, 1, 2, hold, to ear lobe, release, 1, 2, hold, and back of the ear number 1, release, 1, 2, hold and glide. So that's one side of the lymphatic drainage done, and we're going to do exactly the same thing on the other side. 3 important things about the lymphatic drainage is: don't lose the contact. If you do, you have to repeat that note. Don't press too hard when you do your pumps, and don't rush your pumps. Take your time and do it as slow as 1, 2. The reason not pressing too hard and not rushing your pumps is to be able to lift all the fluid to be able to drain it. Now we're going to mirror the same thing on the other side of the face. That's the lymphatic drainage done. Now the first stage is over. The next one will be the hydrofacial part. Britenol pigmentation protocol. We're going to be moving to the hydrofacial part of the pigmentation protocol after the lymphatic drainage. The first step of the hydrofacial for the pigmentation protocol would be the deep cleanse and exfoliation stage. We're going to be using our large blue tip. Our serum will be the Active 4 serum, turning that one on. And our strokes are going to be long, fast and extremely overlapping. We're going to do 2 passes, and the pattern we're going to use will be the cheek, the other side of the cheek, and then the middle bit. So chin, upper lip, nose and forehead. This is our hydrofacial handpiece. So we're going to put our large blue tip on our handpiece, just sits in. This, the minus and the plus signs here, this one controls the flow. So this means that we can control how much serum that comes to the tip, to the face. And for the deep cleanse and exfoliation stage, it needs to be just off minus. We're going to turn our Active 4 serum on, go into the hydrofacial button, and then we're going to drop our vacuum setting to 14. And when we press the on button, we're ready to go. I'm going to turn the face this side. Our strokes are going to be long, fast and overlapping. The purpose of this step is to remove the layers of dead skin cells. So we're going to anchor the skin to stretch and make sure we do a few dabs on the skin before we start our strokes to make sure we got enough serum coming, and then we start our strokes. Long, fast and extreme overlaps. Move the anchoring hand along as you move to the other side of the face. As you can see, got really nice even erythema, and then I've come all the way to the orbital line. So I'm going to hold from the nose and do one across on the orbital line. Now what I'm going to do is I'm going to go and deposit a little bit of this Active 4 serum on the nose, just to get my blackheads and impurities nice and soft, ready for extractions. And then we move to the other side of the cheek and repeat the same. So anchor the skin, make sure that we do a few dabs, the serum is coming, and start our strokes. Long, fast and extreme overlaps. Moving the anchoring hand along, really overlappingly, covering the whole area. Again, holding from the nose, one across. Again, now I'm going to move to the middle of the face, but before I'm going to deposit some more of the Active 4 again on the nose area to make sure I get all the blackheads, impurities nice and soft. So we're going to start with the chin. Again, stretch the skin. For the upper lip, we put our thumb in the middle and make sure the serum is coming, and we do a few strokes out each ways. Again, deposit on the nose to get all the blackheads and impurities nice and soft. And then moving to the forehead, do a little triangle in the middle. And then start from the middle and break as many times as necessary to keep the contact and also be able to move as fast as the area allows you. And then the other side. That's the first pass completed. We're going to repeat exactly the same as the second pass. With the second pass completed, now we've done our deep cleanse and exfoliation stage. Our next stage would be the acid peel stage. The next stage is the acid peel stage. We're keeping the same large blue tip on, and we're going to take our hard cartridge out and insert our Glycol Prep 7.5. So turn the arrow, which is at the lock position on the handpiece, to the unlock position and pull out. This can sit in one of the holes here, and we're going to put the Glycol Prep, which is 7.5, and just clicks in. We can put our flow a little bit higher at this stage, and we're going to be using 1/3 of the vial on the face area. So you get about 3 patients out of each vial. I'm going to start putting it on the nose so it stays there longer before I start feathering on the rest of the face, so that the blackheads and impurities get nice and soft, ready for extractions. I'm going to follow the same pattern, and we're going to use the feathering motion. Again, stretch. And then dab on the skin to make sure it's coming. And then we're going to be feathering, which is almost like scooping an ice cream. And do like almost 2 rows on the cheek area. A few dabs towards the top on the orbital. And very, very lightly with your fingertips, spread it all over. Move to the other side of the cheek. Make sure it's all come in, and scooping on the lower jaw on that row, up again towards the cheekbones, and then a few dabs to complete it, and very lightly spread it. Probably about 3 to 4 dabs on the chin area and spread. Upper lip on both sides, and again on the nose. Generous to get all the blackheads and impurities nice and soft. And then for the forehead, we do a few dabs all across and lightly spread. This stays on the skin for 1 minute, and then we will neutralize it with water. Some patients may tingle, some patients may not experience any tingling. If there is tingling, make sure you get the feedback from them and wipe as many times with the water as the tingling goes. The next step is the extraction step. So for this step, we're going to be changing our tip to the teal tip. We finish with our acid peel, so we take that one out, our vial out, and pop our hard cartridge back in. So the arrow on the hard cartridge goes into the unlock position on the handpiece and very gently turns to lock. The serum we're going to be using for the extractions is Beat HD. Turn that one on, and we're going to put our vacuum up to 20. For the extraction stage, we can go from 20 to 30, whatever level the patient and the skin can take, as much as that you can keep the contact. Our strokes are going to be short, forwards and backwards, and the trick about this stage is going very slowly to be able to literally suck everything out. So we're going to tell the patient to breathe from their mouth as you're going to be pinching and fiddling with their nose. And then we're going to pop the handpiece on, make sure the serum is coming, and we're very, very slowly, we're going to go forwards and backwards. Next, overlapping the line, forwards and backwards. Forwards and backwards. This step is very straightforward. The important thing to remember is to move very slowly to allow the spiral design, the vortex fusion, to do its job, to be able to suck all the blackheads and impurities that are on the surface and close to the surface. And the rest that are on deeper levels of the skin will be bringing them up to the surface to get them out in the coming sessions. And then to do the bulb of the nose, we give them a little bit of a piggy nose, pop the tip on, get the full contact and twist 90 degrees. Piggy nose, get the contact, twist 90 degrees. This is called kiss and twist, and we're going to be repeating the same on the other side of the nose. Again, forwards and backwards very slowly. Forwards and backwards. Forwards and backwards. The bridge of the nose is the hardest part to do these movements. So if you must, or if there's quite a lot of congestion and blackheads, the best way to do the bridge is to lift the skin to create yourself more tissue as you're directly on the bone to make it a lot comfortable for the patient. You can use the kiss and twist method if you get the contact, or you can try your short forwards and backwards movements as well. Extractions, wherever you like to do them, whether it's on the nose, whether it's on the chin, cheek area, back, anywhere else, is the same principle. Short strokes are forwards and backwards very slowly. The next step for the Britenol pigmentation protocol is our Britenol booster. So after the extraction stage, we're done with our tail tip, so take that one off. We're going to put on our large clear tip. We're going to take our hard cartridge out and pop our Britenol booster. Going to remember to drop the vacuum down back to 14. Now, Britenol is only done on the pigmented areas with a kiss and twist method. So we're not going to be using the same pattern of applying it everywhere like the cheek, middle bit. We're going to be very selective on where the pigmented areas are. So we're going to pop on the pigmented area and then twist 90 degrees. And Britenol is done in 2 passes. Once you cover all the pigmented areas, go back to the same areas and repeat it as a second pass. After applying our Britenol booster, it's very important that you let it dry before you move to the hydration stage. The next step is the hydration stage. We're going to be using our large clear tip. We're going to turn our Antiox Plus serum on, and we are going to saturate the skin really well with this serum, applying it thoroughly, feathering all over the area. Again, a few dabs to make sure the serum is coming, and short strokes of feathering overlappingly, almost fitting about 3 rows in one cheek. And then the second one. And then dab on the orbital line to finish the area off. And then we'll move to the other side. Again, repeat the same on this side as well. Dab, dab to make sure the serum is coming, and feathering overlappingly, really saturating the skin. At this stage, you would see the serum much more than the rest of the stages. And it's important that you let the skin absorb the whole serum rather than rubbing it in. And then we move to the middle of the face, starting with the chin. And then dabbing overlappingly on the upper lip. And then dab dab on both sides of the nose and bring it to the bridge with our fingers. And then either feather or dabble on overlappingly on the forehead. The protocol for the hydration stage is 1 pass, but you'll find that some of the skin types will be much more dehydrated than the rest. So once you complete your whole pattern, wait a few minutes to see how the skin takes all the serum, and if there is any dry patches, you can actually go and fill in the gaps by applying a bit more of the serum on those targeted areas. And then the second time round, you can actually fill in the gaps by just dabbing where there is more dehydration. In a few minutes, let the skin absorb, and then we'll be done with the hydrofacial stage of the whole process. Now, after the hydration stage, we're going to do the perk eyes and lips to complete the hydrofacial experience. 2 areas Hydrafacial doesn't treat is under the eyes, around the eyes, into the eye socket, and also directly on the lips as well. So that's where the perk steps in. At the back of your machines, you'll have your upgrade and your switch. So we were at position number 2, treating our patients with the Hydrafacial, and to be able to use the perk, we're going to turn this switch to number 1. We'll have our perk tube, and I'm going to start with the perk eyes. So I got my perk eye vial ready to attach to my tube. Literally screws in, and then we're still going to be using the Hydrafacial screen, and then the R vacuum is going to come down to 7 for the eyes. And when we hit the on button, we're ready to go. We're going to start from inside the face, coming up towards outside around the orbital line, and we're aiming to do like 3 lines going up really close to under the eye. And we're going to try to do the same on the upper lid here as well, coming down from the bone, working our way in, and short strokes of rolling the ball technology, using half of the vial in the treatment and the rest the patient will take away. So I'm going to dab a little bit to start to make sure the serum is coming, and then I will move in short strokes on the orbital line first. And then I'm going to pull the skin down and go in to the orbital area. And then I'm going to ask my patient to look at me and really go under. And then I'll move to the top of the eyes, again starting from the middle, on the bone first. Stretch the skin to come in. And then one more. As you can see, there is the white line, so anywhere in the line is where you will come in the treatment. That's how much serum you would use, and then the rest the patient will take away. So we're going to repeat the same for the second eye. Once you finish the treatment, always show the patient how they will be using the vial at home. So show them that they're going to be rolling it under the eyes and on top. Same on the other side, under and over the top as well. They'll also have 2 eye masks to use at day 10 and day 20. So both of the eye masks are exactly the same, so it doesn't matter which one they use first, but they'll be using one at day 10, the other one at day 20, and in 28 days they'll come back and have another treatment. Next we'll do the lips. So this time we're going to have our Perk lip serum. So pop that one on. Exactly the same way. This time our vacuum is going to go up to 11. And again with the same movement, starting from the middle, working our way out, short strokes of rolling the ball technology. As you can see, she is already had a different color on her bottom lip to the top lip, which gives you instant results of a color change and a plump up as well. The peppermint oil is the one that makes the color change, gives them like radiant color. And then we're going to move on to the top lip. And with the Perk lip serum, again, same as we will use the half of the vial in the treatment and the patient will take the rest home. We will also be giving them the SPF lip balm that they will be using at home every day after applying their serum. Both the perk eye and lips are applied twice a day. The next stage is the LED light therapy, and I'm going to be using the red light. On the main screen, from the home button, we're now going to go into the LED light therapy. This is our timer, and every spot that we're going to be doing the LED lights, we're going to spend 30 seconds. So the timer will come quite handy to watch your 30 seconds, otherwise you're going to have to time it one way or the other. And red lights, as the sticker indicates, they're touch sensitive, so as soon as you touch the sensors, they come on. And then we're going to start our timer so we can look out for our 30 seconds. Please keep your eyes closed. And our points will be number 1, overlappingly move, number 2, overlappingly move, number 3, overlappingly move and up, number 4, 5, 6, corner of the eyes, 7, 8 and 9. And this is done 2 passes. So we'll come back and follow the same pattern again. The important thing to stay 30 seconds on each spot. 1, 2, 3, 4, 5, 6, 7, 8 and 9. Once you've done your 2 passes, the LED light therapy is completed as well. As you all know, how the lights work, the more you do, the better results you get. So once you finish your treatment, if you got a few minutes left, you can always do another pass or concentrate on problematic areas to get better results. To finish the treatment, we would apply our Pure Moist Oil-Free Home Care Serum just to top up our hydration levels. A pump into the palm, get it onto the skin with the fingertips, and then nicely spread. And then starting from the temples, slightly tap the skin to push the product deeper. And then the last thing that goes onto the skin would be the SPF. And this one, we don't slap to the face, we actually gently put it for it to act as a block on the surface of the skin. We're all done and our patients are nicely glowing after their treatment.